everyone, this is Destiny with another nursing video about vital observations. The vital observations that we are taking today are temperature, pulse, respiration and blood pressure. When you're going to take vital observations, as a nurse, there are key procedures that you must follow. One of them is preparing yourself by washing hands, because you cannot touch instruments before washing your hands. Then you prepare the instruments that you're going to use. After preparing your instruments, you come to the patient, create a report, explain the procedure to the patient, obtain consent from this patient, screen the bed, then go back and wash hands so that you touch this patient when your hands are free from infections. As a nurse, before you start the procedure, you must prepare the equipment that you're going to use. Like now, checking if my equipments are in a working condition before I start the procedure, and ensuring that everything that I'm going to use is available. So everything I'm going to use is available here. Now I'm going to go and create a report to my patient and I carry out the procedure. So here is our patient. Like we said, you cannot do anything to this patient before creating a report and explaining the procedure to that patient and obtaining consent. So watch me as I create a report and I obtain consent from this patient. I'm Msawa Destiny. May I know your name, please? So, Madam Esther, I'm here to take your vital observations. That is your blood pressure, your temperature, your respiration, and to know how your heart beats. Am I allowed? Thank you so much, Madam Esther. As a nurse or as a midwife, before you touch this patient or before you do any procedure, you must obtain consent, because this patient may decide to refuse the procedure. So before you do the procedure, obtain consent. Now let's proceed to the procedure. So I put on gloves for personal protection, because as a nurse or as a midwife, your protection first. So I'm going to start with temperature, and I'm using this dicto thermometer. Before inserting this thermometer, I must first clean it. And when you're cleaning, you clean from outside, inside. Then, I cannot insert my thermometer minus cleaning Madam Esther's armpit. So, Madam Esther, I'm going to dry your armpits. We dry from in, out. Then after drying, I'm going to insert my thermometer like this. So, Madam Esther, you're going to put your hand like this. Don't worry, it's not painful. So you can put this hand here. So as I'm taking Madam Esther's temperature as well, I'm going to be taking her pulse rate. So I'm using the nurse's watch to count the beats of her heart. I feel for the radio artery. I first confirm its rhythm, then I time. So I'm done. If I continue, I'm first going to record her pulse, because I might forget it. Then I come back and take her respirations. With her respirations, I don't want her to be aware of what I'm doing, because when she's aware, she's going to start breathing deeply, interfering with with my recordings. So I'm not going to tell her that I'm taking the respirations, but I'm just going to be observing her chest movement in and out. I do this as I time her on the nurse's watch. So I'm done taking her respirations. So before I continue, I also record that. Like we say, in the respirations, you see the chest moving in and out. That is 1. So I have timed for 30 seconds, and then I multiplied my results by 2. So I'm sure by now the thermometer reading is ready. So I remove the thermometer, I read. Then, after obtaining the reading, I clean my thermometer. The other time, I cleaned inside out, outside inwards. Now, after removing this thermometer, I'm cleaning from in out, like that. And then I dry, still from in out. After drying, I'm putting back my thermometer. Then I record her temperature. So from there, I'm going to proceed with taking her blood pressure. So Madam Esther, how are you feeling? Are you scared? No. Okay. So I'm going to take your blood pressure. I'm going to put this cuff onto your hand. It's not going to be painful, but meanwhile I'm inflating, you might feel some pain, but it's not going to last. So you explain the effect of this cuff to the patient so that when the pain comes, she's not scared. Rest your hand here. So you feel for the bronchial artery, just like we felt the radial artery. So before you start inflating, you have to first feel for the bronchial artery. After feeling for it, you get your stethoscope. Before putting this stethoscope on the bronchial artery, you must first ensure that it is in a proper working condition. Thank you so much, Madam Esther. Thank you for your cooperation. Hope this thing wasn't painful. Yeah. Yes. So after obtaining Madam Esther's results, you have to explain them to her because she's anxious. But as a student, you must go ahead and take these recordings to the staff around or to your senior. That's it for today. Thank you for watching. Hope it has been educative. Don't forget to subscribe to our YouTube channel. It is International Paramedical and Nursing YouTube channel. Don't forget again to leave a comment, to leave a question, just in case you have one. And again, don't forget to click on the notification bell. Thank you so much. Bye-bye.
omuzadde ayagaliza omwana we okusoma obusawo ng'amaze siniya ey'okuna oba siniya ey'omukaaga kankwanjulira ettendekero ly'abasawo ery'omutindo International Paramedical Nursing and Midwifery Institute Maya. Tusomesa courses mu certificate ne diploma mu nursing and midwifery, medical laboratory, pharmacy, records and archives management, clinical medicine, dental, sako business and management courses. Ebigezo tutuuza bya WAHEB, UNIMEB ne UBUTEB era twakakasibwa ministry ebyenjigiriza. Omuyizi amaliriza okusoma tumuyamba okwetandikirawo emirimu nga tumuwa entandikwa y'ebyuma. Tugaba ne basale eri abakola obulungi ezifunibwa ku ssomero oba mu ofiisi y'ebyenjigiriza ku Bulange Mengo.